Welcome to the office.
Welcome back, sir. Now, we had two adjustments. You came here for vertigo, dizziness, and some back stuff.
Yes.
Tell me what's changed, if anything.
My pain, my inflammation, everything else went down my back.
Okay.
My dizziness, however, still feels tingliness and like tickliness.
Let's talk more about that then. Okay, so the dizziness and the vertigo, that has not changed at all.
No.
Okay. The swelling in the back pain, the mid-back, the neck, that's doing better?
Yeah, everything's pretty much gone, subsided.
Okay, but this vertigo, dizziness is there. You're getting a tingle behind the ear.
Yes.
Okay, so we need to now check a little bit closer as to what's going on. We did a preliminary scan. We're going to do it one more time just to confirm and make sure. We started on your atlas, C1, and your low back. So we want to check and go a little bit higher and see if the occiput is involved, which I think it is. Okay?
Sounds good.
All right, dude. So what I'll do is this. Let's rescope and let's check, and then I want to talk a little bit about that for you and everybody else to learn about the upper cervical and the occiput. Okay?
Great.
Starting at the base of the neck. And we started off on atlas. And today, it looks like a break on the left, but it's actually not today. It's a break on the right. And it's a tiny one up top, about 4 points. Top right, occiput. And you know what the occiput is?
I do not. Can you brief it down or explain it to me?
You want me to break it down?
Yeah.
All right. I'm going to break it down for you and everybody else. Let's see what else is going on here. Alrighty. Mid-back is looking good. Mid-back swelling has come down quite a bit. And we still have down about 5 points in the sacrum, okay? So we have down in the sacrum and we have up in the occiput. And before I get into the palpation of the low back of the pelvis and the sacrum, I want to talk a little bit about this so you understand what we're doing here and how that can affect it, right?
Yes.
So on our first visit, we talked about upper cervical. We talked about TMJ. All of that can affect the hearing or the inner ear or the vertigo or the dizziness. Yeah. And there's the inner ear bones as well. We do an adjustment for it. If it fixes it, great. If it doesn't, that's okay too. But we're trying to figure out now what's really causing it. And in the Gonstead work, it's really this, right? His whole philosophy was expect a neuritis first for any condition. What does that mean? Neuroitis, inflamed nerve, right? Mm-hmm. And the symptoms that we get of numbness, tingling, loss of function, pain, all of this is a function of or dysfunction of the nerve. So today, let's talk about the occiput. This is the upper cervical complex. This is the occipital bone. That's this bone here. This is where the skull sits. Okay? C1, atlas, that's this one here where you feel those bumps. And then we have C2, which is the first big bump or the first vertebral prominence. Yep. Now, let's go and see the cross section. This hole here, it's called the foramen magnum. Now, watch this. If we have upper cervical issue, let's say it's occiput. Occiput's primary motion is nodding. This. Atlas primary motion is rotation. Yep. In your movement, and what we need to feel is that occiput moving or not? If the occiput, watch the hole here. If the occiput misaligns back, put your fingers in there. Put 2-3 fingers, make them nice and snug. Straight through. Okay. Your fingers, they'll represent the spinal cord.
Okay.
Now imagine if this misaligns up and over.
It's hard to turn.
Describe what it's doing to your fingers.
It's pinching air, like harder to move.
It's putting some pressure.
Yeah.
Yeah?
Yes.
So the pressure is affecting what? Your spinal cord. And depending on which part of the cord it's hitting, it can affect different tracts. It can affect everything down into the legs. Okay, now let's say it's the atlas. Keep your fingers in. We started here. we started up on the left, over. That's clear now. Okay?
Yes.
Now we have to do it's up on the right.
I see.
That's what we're going to work on today. So the occiput has nerves that come out. It comes out from here. It does affect the face. It does affect the eyes. It does affect TMJ. TMJ can also affect all of this.
So because of that, it made TMJ, my back, and...
Possibly.
Okay.
Okay? Let's see what happens after the adjustment. You'll give us all feedback and say good, bad, same, whatever it is.
All right.
Fair enough?
Sounds good.
Let's motion the occiput. Sit back for me, please. And as I said, the primary motion of the occiput is nodding the head. So this is okay. Left side. And I'm not trying to teach how I'm doing this. I'm just demonstrating, okay? We'll teach it in other videos. This is the right side. Now, can you explain to me and everybody the difference when I do this side versus this side?
This right side seems more unable.
A little more stuck?
Uh-huh.
Okay. Right hand up. And down. Okay. Can I take this part off, please?
Sure.
All right. Let's do the occiput. PS, LS. PS, LS. Nice and easy, brother. Oh, wow. I'm going to have to redo that one. That was a great miss. He's a little greasy on me. Hold on. A little hot out there. Oh, good. You mind taking that off, too?
The mask?
The mask, yeah.
Sure.
Okay. Just make it easier for all of us. Gotcha.
Oh.
Give that a second, please. Okay. You can put the mask back on. We'll come back and check all of that later, okay?
Okay.
Come back over here, face down. That's a tight bugger. How long you had the vertigo for again?
2 years?
2 years. So we got to break through 2 years of that. Slide up. I got to go a little gangsta on you. Is that okay?
That's cool.
Gangsta love though, okay? Slide down. Turn your head to the right. Right hand there. Okay. And I want to get a little more of that occiput this way. We're coming. Chin down, please. Chin down. Look down. No, look down. There you go. Gotcha the rest. Nice. That wasn't too bad, yeah?
No, that was not too bad.
Chin up, please. Nice and easy. Go. Gotcha. As you're walking even, tell me if anything is different up top there.
I feel like tension and released or
Up here?
Yeah.
Have a seat. Let's check. Okay. Oh yeah. Sit back for me, please. Let's re-motion first. Left side. Right side. Little better. Little better. A lot of tightness there. And the second part of that is going to be, remember the posture, right, on his x-rays? And that anterior head carriage, when your head is going like this, it's also straining a little bit there. I'm going to use the machine up top. As I'm doing that, if anything starts to tingle, just raise your hand, okay?
Okay.
If anything starts to tingle. You good with that? Nod your head slowly. Just with your chin. Up, chin down. Chin up, chin down. Chin up, chin down. Chin up, chin down. There you go. Let's walk that off one more time, please. And as you're walking, actually walk it off a few times. As you're walking, turn your head slowly to the left and to the right. Look up at the ceiling and look down. Good. Good. Keep going. Okay. Have a seat over here. Look all the way up at the ceiling. Up and to the left. Up and to the right. Bueno. Down. Down left. Down right. Diferente.
More mobility.
More mobility. How is the tingle behind the ear when you started?
How is it right now?
Yeah.
It sometimes occurs. I don't know. I just feel it out of the blues. Like right now when you were doing with the little massager.
You felt a little
You
bit
felt
of it? Okay. Sit back for me, please. What I'd like you to do is make notes, please, starting today now.
Mhm.
And I want you to tell me if anything is different on our next visit. Tell me, I felt it 5 times, 3 times, whatever it is. Okay? And more importantly, not just the tingle, the dizziness and the vertigo. Okay. Sounds good. You got it. Let's recheck that. Yeah, we got maybe a couple more, 1 or 2 more on this occiput to free up, okay?
Mhm.
Awesome. Sit up straight. I want to do the right shoulder over, around. Let me do the work. There. Awesome. Okay, on your back, please. Questions for me, sir?
No, as of right now, no.
Raise your right leg. Ankle. Raise your left leg. Okay, stand up for me, please. Let's check the hands. And squeeze. And squeeze. You working today?
Yes.
Squeeze. Okay. Homework. Ice occiput sacrum 2-3 times a day. Sleeping on your back, please. No pillow on your neck.
Okay.
And I'd like to see you either end of the week or next week, Monday.
Okay.
Okay? And then you'll tell us the difference. Squeeze. Squeeze. You're all set, brother. Questions?
No.
Okay. I'll see you next week.